Well, I've been very lucky this year. I've been involved with Invasix UK, the manufacturer and distributor for the Bodytite and FaceTite system. And as you know, I've been doing those treatments for many years now, and some really, fantastic outcomes. And I just, was involved in workshops and thought, I've got to an age where perhaps I could benefit from some of these treatments. Like many men of my age, in late 40s, 50s, you start to gain a bit of a spare tyre around the middle that doesn't seem to shift, even if I sort of go on a diet, or I do a lot of exercise, I do a lot of cycling and skiing and running and gym work, but it never seemed to be able to lose it from the midriff. So I was quite self-conscious about that, and the fact that I couldn't wear some of my tighter shirts and some of my suits and things like that that became too tight. So I just thought, well, hang on a minute, maybe it's an opportunity for me to have some treatment. So I was very, very lucky to have a Bodytite at my abdomen, and that was about 4 or 5 months ago now. And yeah, I can say it was definitely a very positive experience for myself. No, I mean the Bodytite procedure it's minimally invasive, as it does involve a small operation. It's done as a local anaesthetic. There are a couple of little tiny nicks in the skin, little tiny scars from where the anaesthetic's put in and the fat's taken out, and the subdermal tissues are all heated up. But no, really nothing of any major cosmetic problem there with any scarring. Yes, I mean the procedure itself, I had it undertaken by Amy Khan in London. Very nice, very confident, very good doctor, and he managed to take out a good amount of fat. It was actually a couple of litres of fat came out. To my surprise, I didn't think there was that much, and initially I was quite swollen. I was probably uncomfortable for a day or two, but I was back to work on day 3, a little bit sore. I didn't go to the gym or do any exercise for a couple of weeks, but I then was soon back on my bike. Probably the worst bit about it all was having to wear compression, this tight garment for the 6 weeks. Luckily it was through the autumn, and it wasn't too hot. But now after that garment was dispensed of, I haven't really looked back, and over the months the skin has contracted back, and it's much tighter, and I've got the figure that I wanted, and I've even feel a little bit of a six-pack underneath it now. So yeah, really pleased with the result. Well, that's right. I mean, the fat won't come back underneath the skin. If I put weight on, it's likely to be inside my abdomen, which is never a good thing. That's what we call the dangerous visceral fat. And I'm aware of that. Certainly as a doctor, I have lots of conversations with patients about not avoiding putting fat on inside the abdomen. So that comes down to a really healthy diet. I mean, I've maintained my exercise, and I do work on my diet quite a bit to have as healthy a diet as possible. Yeah, it's been great in that way that I've had a different insight as a patient myself to be able to empathise and help my patients, and certainly probably some of the lessons I learnt from it was that it can be uncomfortable after the procedure, and you're a little bit limited in what you can do, and that's important that patients are aware of that. And I think having an operative procedure can be quite scary, even though it's a very safe and procedure under local anaesthetic. So I'm aware that patients can be very stressed maybe going into this, and we can do everything then to really help them through the process that were on the day of their operation, and before and afterwards. So yeah, it's been very, very enlightening and a good learning exercise for myself.